access to quality healthcare is one of the human rights enshrined in the Constitution of the Republic of South Africa. But this is not the case for many South African women still faced with inadequate healthcare systems to contend with, and also some still being denied their right to healthcare or freedom to have a say about their bodies. Section 27 is one of the social justice organizations that has strived to change the narrative for many and advocate for women's health rights. And this morning we joined in studio by Sasha Stevenson, Executive Director of Section 27, to take a closer look at some of the interventions being made to improve health systems impacting women. Sasha, good morning. Thanks so much for having you in studio with us.
Good morning. It's lovely to be here.
So it is Women's Month, you know, the focus on all things women. And of course, healthcare is, you know, a pivotal right for women for various reasons. How would you say we're faring in terms of what our Constitution enshrines and, you know, gives to us as citizens of this country and women in particular, as opposed to what we receive?
Well, of course, there's always a gap, unfortunately, between what the law says, what the Constitution says, and what we see in reality. For a lot of women around the country, access to healthcare services remains a real struggle. And I think what's really interesting is that women are much better at trying to seek access to healthcare services than men. They have much better health-seeking behavior, and that's partly because women give birth, etc., and so they have more interaction with the health system. But even given those attempts, women are struggling to access the services they need, to access contraceptives, to access abortion services, to access even maternal healthcare services. And that's a huge problem for women's personal development and also for society at large.
Why is it the case, Sasha? Because one would imagine, if you look at the money that we spend towards healthcare services for South Africans, that things would have improved drastically by now. So what are the problems? You know, where are we falling short? Where are, you know, the bottlenecks occurring?
We do spend a lot of money on access to healthcare services. I mean, what we must recognize is that we spend over 8% of our GDP on health, but that's across the public and the private healthcare sector. And the private sector accounts for about half of that spending. So we already have a hugely inequitable allocation of resources between public and private, and that can't be ignored. But at the same time, we are seeing decreases in the amount of money being spent on access to healthcare services. So the health budget decreased this year and is scheduled to decrease over the next few years. And this means that there is just less money available for services. And then at the same time, we see problems with the way that that money is spent. Health is a particularly corruption-prone sector. That's partly because there's just a lot of procurement. There are a lot of services and goods that are required. And so there's a lot of wastage of money within the system. But we also don't see the kind of accountability mechanisms that are required to ensure that when something goes wrong, there is accountability, that people are accessing the services that they need. So there are a variety of issues that will be familiar to all South Africans, but the impact is really dramatic and really negative for many people, and particularly many women across the country.
And we know Section 27, you know, to have taken up many of these causes right up to the courts in this land in order to make sure that that which is envisioned actually does materialize, not just in health, but in education as well. But as far as healthcare is concerned, just in terms of some of the litigation that was brought, not necessarily by yourselves, but just generally, do you find that government is compliant when it comes to court rulings?
Yeah, so I mean, it's a mixed bag. What we are seeing is that there is compliance where there is careful monitoring. You know, you're right that there has been a fair amount of litigation on the right to health, starting from access to prevention of mother-to-child transmission of HIV in the early 2000s. And then more recently, the life esidimeni litigation that we've been involved in for 8 years, 4 rounds of litigation, really. And then most recently, the case about maternal and child health and ensuring that everyone in South Africa who is pregnant or breastfeeding breastfeeding or a child under the age of 6 has access to free healthcare services. Now that case, we got an order a few months ago, and it requires the state to put posters up in clinics and hospitals around the country to let women and their children know that they're entitled to access those free services. And our monitoring so far is suggesting that those posters are indeed going up and women and children are being seen for free where they need to be. So that's positive, but it does take that continuous monitoring, because we find that if we take our eye off the ball, it's very easy for some of the gains to be lost.
And I would imagine it's a very difficult balancing act, because on the one hand, you want access to services, but on the other hand, you're hoping that it would be access to quality service.
Absolutely, and that really is the much more complicated element. And we're very fortunate to have excellent healthcare workers in South Africa. We really do train and nurture some of the best. And we need to look after them, because they are the backbone of our healthcare system. So we need to make sure that they remain in the country and, importantly, in the public sector. And there are lots of pushes and pulls for them to get out of the public sector. So that quality element is so important. It's linked to the quality of our healthcare workers, but also to things like the Office of Health Standards Compliance assessment of all health facilities to ensure that they comply with certain norms and standards. There was nothing like that before, I think it was 2015, when the Office of Health Standards Compliance came in. So those kinds of processes and structures are really important to ensure quality healthcare services. And what we know is that very few of the facilities that the Office of Health Standards Compliance monitors at the moment are actually compliant with the norms and standards. And those are largely about infrastructure and processes, but obviously the infrastructure and processes really feed in to the quality of services that people will receive.
And then, of course, Sasha, you know, when you speak to people, especially those who make use of the private sector healthcare facilities, one of the complaints is always about access, and access in this instance of just being able to get into a facility and be seen, or being able to receive medication, whatever the case may be. And people complain about the fact that our facilities are overrun. And you have people coming in from neighboring countries, for example, to give birth, to access ARVs. You know, you can go on and on. So what is your observation in that regard, and what do you think needs to be done?
So I think the first thing to be said is that there is often a lot of rhetoric about the impact of people who aren't South Africans on the healthcare system. But there really is no data on this. You know, government often complains about health facilities being overrun by people who aren't South Africans, and yet we don't actually have the numbers. So I think it can be quite short-sighted to blame the strain that the health system is experiencing on non-South Africans.
But I'm not talking about government in this instance. I'm talking about ordinary South Africans who are the people who actually make use of these facilities.
Yeah.
I can show you emails that are written to me about these matters where people go in and they say, we are unable to get in.
Yeah.
And on occasion, I have gone with someone, and this was found to be the case.
Yeah.
But that's an isolated incident. So I cannot speak empirically to that matter. But there does seem to be an issue there, quite apart from what government is saying and what government tries to scapegoat. But is that something that we ought to be looking at? Because if we are budgeting for 10 people, and there are actually 100 people making use of the services, then surely we're not going to win.
Sure, and you know, of course, there are facilities where there are more people who are not from South Africa than other facilities. So certainly individuals have that experience. I think the problem is not that we are budgeting for 10 South Africans and we get an extra 90 people who aren't South Africans. It's that we are budgeting for 10 South Africans, there are 50 South Africans coming, because our budget keeps on decreasing. And we can't expect a system to be able to be maintained if we're not funding it, if we're not managing when things go wrong. So yes, the utilization of our facilities is an issue. You can't do border control through health access control, but it is important that we recognize that our health facilities are under strain. They're under strain because there are more people than we're budgeting for, more South Africans and non-South Africans, and because we are decreasing those budgets and not managing the system as we should. You know, one of the ways that government is hoping to remedy this is through national health insurance that would use all of the health facilities in the country for all of the people, essentially at its core. Now, there are huge problems with the way that the NHI bill anticipates doing that, but the principle is good. We have resources, health resources, human resources, facilities across the country, some of which are not busy and some of which are overcapacitated. And if we can find a way of making sure that everyone can access services based on their need rather than their ability to pay, then we serve all of South Africa better. So there are ways that we can improve access to healthcare services, but it does require investment, and we're not seeing that investment. And it does require a real dedication to improving quality, and frankly, we're not seeing that either. What we're seeing is a lot of talk about the passing of a bill, and what we really need to be focusing on is improving our healthcare facilities, making sure that our healthcare workers stay, and that we're able to serve everyone in the country, because that's important for individuals, for women and men and children in the country, but it's also important for our economy, that we have a healthy population. It's important for public health, because we found out under COVID, everyone's health affects everyone else. So health is a really vital area for investment and focus, and until we get that right, we're going to continue seeing the kind of inequities and problems that we're seeing in the country.
Right. Sasha, we're going to have to leave it there. But I think, very interesting points you raise that we really need to reflect on as a nation. Sasha Stevenson is the Executive Director of Section27, talking to us about advocating for women's health rights and interventions that are needed to improve the system.